if you're going to be as successful as I think you can be, then it's really about what we call the Crabtree Creed. You have to get control of the things that are within your control. Let me just read it. You must get control of the things that you can control. If you don't, then the things that you have absolutely no control over will control you. Can you control what Barack Obama does? No. Can you control, what if he does health care? What if he does some kind of dental insurance thing? Can you control that? No. Can you control what the economy does? No. Can you control whether your patient base has a job? No. What can you control? I would submit that there are lots of things that you all can control that you don't realize that you can control, and because of that, the things that are beyond your control end up controlling you. And so, it's the economy. It's our patient base doesn't have jobs. It's we can't get them to pass credit. It's a bunch of things. You guys can control whether or not your patients see value. As a matter of fact, let's just for a minute, what is within your control? Do you guys control when you open? Do you control when you close? What else do you control? You tell me.
Staff. Hiring staff.
Hiring staff? You control how many days you work? Do you control how much you charge? Who said no?
I said no.
You don't control?
When you're a PPO practice, you do not control what you charge.
Ah. Do you control whether or not you accept PPO?
Yes.
If you determine whether or not you accept PPO, then you determine what you charge.
I don't control.
If you with me on that, Laura?
Pardon me?
Are you with me on that? If you,
Oh yeah, if you accept, yeah, if you can control or you accept the PPO, but if you don't, personally you don't control if you accept the PPO, then you do not control how much you charge.
I would give you the part that says you do not control the insurance's UCR.
Right.
You control your own personal.
You do control what you charge. And whether or not you accept insurance as a benefit or as an in-network provider is within your control. Do you control how many patients you see each day? Do you control how much time you spend with each patient? Yes, you control that. And it's not iffy. You really do control it. You may not orchestrate it properly. You may not know how to orchestrate it properly. You may not be totally comfortable with the verbiage that allows you to take control of that time. But understand that you absolutely control how much time you spend with each patient. Do you control what is diagnosed? Yes. Do you control the final outcome of the clinical procedure? Yes. Do you control whether or not your patients accept treatment?
Yes.
Yes, you do. And it's interesting how we said yes to all of those things, but yet when you really ask the most important question, which is this, because if you can't do this, if you can't control what motivates your patients, if you can't control the value in the services that you provide and the products that you provide, then you really are giving up control of everything. Think about that for a moment. You really are giving up control of everything. You guys absolutely control this. As a matter of fact, you must get control of this, or the things we talked about earlier that you cannot control will end up controlling you. And there are lots of folks, I'm sure nobody in this room feels this way, but there are lots of folks out there in dentistry who feel like they have no control because they're completely handcuffed by insurance. And I'm not one of these guys who's anti-insurance. I love insurance, as long as it's a benefit and not a crutch. When you don't begin to take control of the things that you can't control, then your insurance becomes a crutch. And then you become at the mercy of it, rather than having that be another tool in your arsenal to help with acceptance, which is the way it should be, which is the way it was intended to be in the 1940s, whenever it came about. It was intended to be that, and we've allowed it to become a crutch. Again, not anybody in this room, I know, and certainly in dentistry as a whole, not as much as the medical arena. But some of us do. Even some of us will go in and out of that. Some of us will understand it, not focus on it, forget about it, and then get sucked into the crutch thing again. And then you shake your cobwebs out, right? And you get back in the groove, and then you wane once again. It's very important that you get control of the things that are within your control, or the things that you cannot control will control you. And 90% of that, in my opinion, is recognizing what exactly are the things that are within your control. So, I can tell you that what you believe, I'm all over. I would submit that at the end of the day, what we found in doing this with hundreds and hundreds and hundreds of offices all across North America and the Caribbean, what we found is success does not come the way you think. Success comes from the way you think. And what you believe is possible, what you believe is true, what you believe is a fact. And when I say you, I don't mean just you individually, although I do mean you individually. I mean you as an organization. You as a team. You as a business. Because psychologists will tell you that whatever it is that you believe will determine exactly what it is that you focus on. Whatever it is that you focus on will determine the questions that you ask yourself and those around you. And I'll give you an example of this in a second. The questions that you ask yourself will determine exactly the emotional state that you're in. The emotional state that you're in will determine, guess what? How you behave. How you behave will determine the results that you get. And those results will turn around and solidify that belief that you had in the beginning and drive that groove even deeper and make it more solid.